Welcome to Data Chats, a Metopio podcast where we talk about turning community data into real-world action. Each episode, we explore how leaders across public health, hospitals, and policy use data to understand their communities, shape priorities, and drive change. Let's dive in. What I'd like to talk more about today is how we can go deeper with the topics we have in Metopio and really dig into this topic a little bit more, especially because the cost of living varies so widely across the US. And so I kind of want to take into account how food insecurity and poverty might look different for different places in America.
I think one of the things when we start with poverty is how much poverty is driven by the federal poverty level, which is consistent across the US, even though, as you say, the cost of living can vary quite a lot.
Right. So that's an incomplete picture, always, poverty itself. I want to first show you this new indicator we have called SNAP Meal Gap. And this is an indicator showing the difference between the amount of money people are getting in SNAP benefits and the cost of a meal. So anything positive here means that people's SNAP benefits do not cover the cost of a meal. And anything negative, which we are seeing sometimes in some of the counties in Texas, means that their SNAP benefits are covering the cost of a meal.
Yep. So broadly, this is a lot like what you would expect with the coasts being more expensive than the middle of the country.
Yeah, definitely. You can see very clear patterns on those coastal counties. I want to zoom in briefly. I guess you can say, is there anywhere you'd like to zoom in? I'm totally open to that.
Oh, I'm fascinated by Colorado here.
Great. I like Colorado. That's what I was actually thinking of zooming in on. Because this shows a huge difference between some of these counties here in the Rocky Mountains, essentially.
Yeah, the mountains versus the high plains. Is that about right?
That's right. Yeah. And Colorado's where I live. So I do know these counties. Eagle, Summit County, Routt County up here. These are all ski resort. There's Routt. These are all ski resort counties. So it's very expensive to buy food in these ski resorts. And you can imagine what this means then for people who are making a minimum wage or around a minimum wage.
Yep, exactly. And quite different from the rest of the state, which is far more, high desert, less resort oriented, less tourist oriented.
Yeah.
Is that accurate?
And exactly. And in some of these counties, it's very doable to buy a modestly priced meal with SNAP benefits.
Now, this is based on the USDA cost of a meal.
Another topic I love that I think is sort of underused. I'm going to zoom back out. It's convenience stores as SNAP retailers.
Oh, yeah. So when you get SNAP benefits, what options do you have to spend them? Somebody in one of these counties looking at their options to use their SNAP benefits, can they go to a grocery store or do they have to go to a convenience store?
Yeah, and that's exactly what we're trying to capture here. Let's look at this here.
That one.
Is that the one?
100%.
McMullen County.
McMullen County, you get SNAP benefits. Your only two options. One is you're going to a convenience store. The other option is you're leaving the county. So I hope you have a car.
That's a great.
And the counties around it also relatively. So you might be going two counties because.
Okay, let's explore what you just said. So let's filter on the places where a high proportion of people do not have cars. Okay. And then let's also filter on the places where a high proportion of SNAP retailers are convenience stores.
Yep.
Okay.
And so now a set of counties that are going to have some problems. Counties that are both above the median, above the 50% mark, the middle of counties in the US for how many people don't have a car. It's not 50% of people don't have a car. It's about 5% of people don't have a car or more, which is pretty high when you're talking about an area where people might need to leave the county to get to a grocery store.
Yeah, and let's put in one more thing related to what you just said, which is grocery stores. And let's see if they actually wanted to use those SNAP benefits and you live in McMullen County, if you want to use your SNAP benefits at an actual grocery store with healthy food, what are your options? They're slim. This neighboring
Yeah.
county has a few.
Have you
Sometimes
seen
you're
them?
crossing an entire county to get to a
Oh
grocery
yeah.
store.
Hmm.
And this is
So
something
yeah.
that I know you've spoken to before, which is it's related to obesity.
Hmm.
Obesity is not necessarily a choice. And let's pull in obesity for
And I think
some
what you're getting
adults.
to here, we have a pretty high correlation. And yeah, we
Look
didn't
at that.
hardly lose anything
Look at that.
between places where people have a hard time managing their weight and a hard time getting to a grocery store and no transportation to fix either of those. And
Hmm.
so it gets us past the idea that obesity is just a behavior, just something that anybody can fix, and more to the point of where do we have spots in the country where it is going to be hard to maintain a healthy diet, especially if you're on SNAP benefits, especially if you're one of those 5% that don't have a car. And
Hmm.
the nearest grocery store is 2 counties away. So I feel like when
Exactly.
we're at this point and you're looking at what you want to address in your community, and one of those things you want to address is a high rate of obesity, you really have to think about what it takes for somebody to really get to work on that in their own life. It's not just
Hmm.
that they don't know. They know. They know what
Hmm.
healthy foods are. We told every elementary school student what healthy foods are for years and years.
Right.
But to be able to get to that grocery store and, with the car you don't have, with the SNAP benefits that you can only spend at a convenience store, that's got to be
Right.
hard. And that's going to be a much bigger project for the public health department or the hospital or the organization that really wants to help, is
Yeah, to
addressing all
overcome
of
all
those
those
together.
obstacles.
Yeah.
Um, on a related note, this reminds me of another topic we just added, and I'd like to visualize that right now. I'm going to remove all of these filters and then change the topic to grocery store density
Hmm. This is one of my favorites too.
because especially in Texas, you really start to see these rural communities that
Hmm.
simply do not have grocery stores. And look, if well, if you're located here, Motley County
Yeah, you've got a ways to
or
go.
King County, you have, yeah, very long
Yeah.
drive to get to the grocery store. The last topic I would like to pull up, and I'm open to other ideas you have too, is um, households in poverty not receiving SNAP benefits.
Hmm.
Because I think this is one that has such a long name that sometimes we overlook it, but it has a lot to say.
Yeah. And it's another one that doesn't always sort of settle in your head the way you would think. You can definitely see state demarcations. You can see where the states, you can see Idaho compared to Oregon here.
Uh-huh. Yeah.
Partly because there are different laws in different states, partly because food stamps are administered at that state level. But really, when we're talking about being in poverty and not receiving food stamps, there are a couple of sort of key factors. One of them being in a lot of places, maybe in most places, there's a work requirement if you are young and healthy and have no children at home. Um, that's waived for somebody who has a disability. That's waived for somebody who's taking care of young kids. But it means that if you're a healthy adult who doesn't have a job, you may be cut off. You could still be in poverty, but you don't qualify.
Mhm.
People who are immigrants, whether documented or not, um, there can be restrictions on how that, not only on how it's allowed, but how it's calculated. So yeah, different states end up with different reasons,
Mhm.
but a lot of
And
them
so,
repeat.
and sometimes too, we see this in wealthier communities.
Hmm.
Um, and whether that's the stigma associated with the food stamps or whether that's that people actually have generational wealth that they can
Yeah,
fall back on.
resources. Exactly.
Resources,
And that's
they're
another that goes state to state. How much can you have in savings? How much do they
that,
include your
yes.
car? Do they only include a second car as a resource that you could sell before you get food stamps?
Yeah. And what you've listed here is a lot of what's included in the technical documentation. And this is also, oops, not that one. This is why I love Metopio's technical documentation. So often, if you just open that little eye, there's so much to be had here. So
Hmm.
these bullet points explore reasons why these these values might differ or why they
Yep.
exist. So you mentioned work requirements, the resource limitation, which is like money in your bank account, immigrants,
Workers on strikes. Okay, we've covered them all. That's great.
I think we didn't mention workers on strike till just now. Yeah,
Okay, that
workers
one we
on
didn't
strike.
mention. Okay, I think that's everything I have to talk about today, but I think
Yep.
it's just great to remember that when we're talking about food insecurity, we can go much deeper than just our food insecurity indicator or
Oh
our
yeah.
food snap indicator. We have so much more to see here.
Definitely. And I think what this tells us is not just who is currently food insecure, who might actually answer that question, yes, that in the past 30 days, in the past year, they may have skipped a meal, they may have not had money for food, but who's at risk? And what
Mm,
exactly is putting them at risk? Is it the transportation? Is it the lack of a grocery store? Is it,
yeah.
all of these things together? And so again, when you're looking at designing a program, considering all of those together to make sure that what you're designing really gets to the root of what's going on. Thanks for listening to Data Chats. If you found this episode helpful, subscribe to get future episodes delivered straight to your inbox. And if you want to explore the data we talked about today, visit metopio.com to see how we help public health departments and hospitals turn insights into action. See you next time.